Hi, it's Dr. Josh. I just interviewed Deanna Hansen. It was a really good interview, not just for people with Alzheimer's, but other types of dementia, concussion. But frankly, I think this interview is going to be relevant for anyone who's got any aches or pains. My favorite part was actually at the very end when we talked about self-care, and she had three specific tips on self-care to improve our body and our brain. You are not going to want to miss this episode. You will learn what in the world does your mouth, your ribs, and your toes have to do with your brain health. Don't miss this. Deanna Hansen is a pioneer in the field of fascia decompression for physical and emotional transformation. With more than 20 years of hands-on clinical experience, Deanna created block therapy, a fascia release protocol to relieve chronic pain and disease, encourage healthy detoxification, and reverse cellular aging. The fascia brain connection, a new perspective on concussion recovery. Learn how fascia connects brain health to concussion recovery. Hi, everyone. It's Dr. Josh with Alzheimer's Breakthrough, and got a special guest today, Deanna Hansen, who is an expert on, I don't even know where to start, on using blocks to help with fascia. And you might be watching, interested in Alzheimer's. Why are we talking about fascia? The reason we're talking about this is, number one, the fascia is very important to the brain in general. Number two, I first heard about you, Deanna, for your approach with dealing with concussion. And it's fascinating that one of the root causes, they're between 30 and 200, but one of the major categories for root causes for Alzheimer's turns out to be head trauma, including concussion, including concussions that may have happened or trauma that may have happened as a little kid. And then many decades later, we see the results. So Deanna, welcome. And does that make sense to you?
Yeah. So thank you so much, first of all, Dr. Josh, for having me here. I love diving into the world of fascia and relating it to issues and concerns through the entire body, because when we can really understand this beautiful system and how it integrates all parts, then we have a direct process to deal with those injuries that can then create long-term negative effects. So I'd love to just talk a little bit about my version of how I see fascia. I've spent over 60,000 hours working in people's fascias with my hands as well as my own, and I've really uncovered a very unique understanding of this tissue from my years of experience. So
But
that's cool to dive in.
yeah, let's start with the basics, because what in the world is fascia?
So I see fascia as really being the cell membrane of every single cell interconnected. So it creates the communication pathways. It also creates both the structure of the physical body and allows us that mobility. So fascia is made of primarily collagen, elastin, as well as other things. But these two proteins, when in balance, give us the structure and mobility with the goal of keeping all of our cells in correct alignment. Because if our cells are where they're supposed to be, there's optimal space in and around each cell, which allows for ease of absorption of nutrients into the cell, as well as the removal of toxins and debris away from the cell. And as long as our system is working with an ease of flow, we don't have this accumulation of stagnancy, which can down the road create dis-ease in the body. But that's not our reality. The reality is we are humans who have been under the influence of gravity since the inception of our time here on the planet. We're also dominant on one side of the body. So we compress over time, but we don't just compress linearly. We literally spiral down one direction or another. And it's the collagen component of the fascia that will migrate to areas of need to create structural support. So for example, if I'm sitting in front of my computer for 20, 30 years in this alignment, the collagen will migrate to areas in the front of my body, the front of my neck, changing the way that I sit and stand in order to keep me from tipping over. But like scar tissue, they block blood and oxygen flow to cells, as well as block the ability for us to keep our cells clean. And that creates the issues that we're seeing in the physical body, no matter what those issues happen to be. Everything from dis-ease, chronic pain, issues with size and shape, mobility, all of those things. So really, fascia will compress and create compression, ballooning, and toxicity in all the areas of the body. My work is all about decompressing the fascia, taking you backward through time in your system so that we can create this wonderful body that can flow with ease. And then we can also repair, rejuvenate, and heal.
That's beautiful. And would it be a fair assumption that for people with Alzheimer's or other brain issues, that you may want to spend more time on the fascia on the head? I mean, obviously there's fascia throughout the body, but is that a fair assumption that when you're working with someone with a concussion or dementia or what have you, that you might spend more time on the skull or the fascia around the head?
That's such a great question, and not in the beginning.
Oh, interesting.
Because there's cause sites to our overall alignment. So whenever I'm looking at a body, I look at the entire system. So I just want to initially talk about the 3 pillars of fascia decompression, and then I'll relate the cause sites.
Sure.
And then we'll go through a deep dive in the head. So as I mentioned, over time, we compress. We compress, balloon, we become shorter and wider as we age, typically. So when we are going through this process of moving backwards through time in the tissue, the first thing that we want to do is we want to get to the adhesions and the scar tissue that have ultimately been put to support our system. We get caught in these fascia grooves based on how we move, how we breathe, all of these things. So the first thing that we do is create the space lost through time. And we do that through the process of pressure over time. So we use blocks, but there's other tools that you can use, even a rolled up towel. And we have a free gift at the end that we'll talk about with that. But pressure over time in any area creates an increase in heat. And essentially, we need to heat the tissue to melt through those adhesions that form, that collagen that migrates, and will then grip to bone with a 2,000 pound per square inch seal. So we're dealing with some really incredible forces in the body. But those grips are magnetic. So again, if you think of a 2,000 pound per square inch seal holding us in these negative alignments, how do we undo that? And so if you had magnets far enough apart from each other, they don't have an attraction to each other. Bring them close together, and then they'll seal with a force. Try to pull them away, almost impossible to do. But if we shear them apart, we can do that. So through the process of what we teach you to, using your body weight and gravity, lie on the tools, and then very slowly you're shearing through the layers of fascia to get to those deeper adhesions. So that's the creating space. The second pillar is inflating that space. And that's done through...
Actually, before you go there, you mentioned magnets. Do you actually use magnets as part of your process too? No, that was just an example.
Okay. Yeah, and just how to ultimately get to that magnetic seal so we can create that release. Okay. So then the second pillar is inflating the space. On the other side of this conversation, I want to talk a lot about the breath. But basically, through teaching proper diaphragmatic breathing, we then direct that blood and oxygen into these newly created spaces so that we can start feeding those cells that are now awakened. And think of blowing up a balloon. When it's fully blown up, it's round, it almost defies gravity. Take half the air out, it becomes wrinkled, heavy, dust and dirt can settle in the creases. So that's what our cells do over time if we're not breathing optimally every single breath. And then the third pillar is maintaining that space. So we have proper postural foundations in our body to support cell alignment. However, if we don't adhere to those and we start falling away, then that's where we start seeing these patterns ingrained in the fascia. So those are the 3 pillars that create the fascia decompression. So we can pull everything back into that proper alignment, because the most important thing here is that breath. So I just want to talk a little bit about the diaphragm. It's a plate of muscle that is at the base of the rib cage. When we inhale, it moves down. When we exhale, it lifts. And when it's working properly, it's creating a continual massage for the organs, for the heart and the lungs. As well, it creates that structural stability for the rib cage and everything above so that we don't allow the rib cage to come crashing down into the core. So we want that strong breath for so many reasons, but the challenge is pain, fear, and stress cause you to reactively hold the breath. And then the fallout breathing pattern is from the muscles of the upper chest. So if we have a trauma, no matter what that trauma is, whether it's emotional, physical, mental, spiritual, all of those things, we go into that protective mode where we hold. A deer that survives an attack will shake on the other side of it to release that negative energy that entered into the system. However, we as humans, we tend to get into this protective mode and then we freeze in that space. So if that happened when I was 10 years old, 15 years old, however old I was at that time, if I don't release that, now my breath is compromised as I continue to move forward through time. So now our cells are really being impacted by the lack of oxygen absorption that's occurring in the body, as well as that inability to properly detoxify the body, because the exhalation is one of those major opportunities to keep the body clean of toxins. So when we have, say, a concussion happen, we have a whole bunch of debris. Think of a car accident. You have this massive impact into your body and there's breakage. The first thing that we want to be able to do is pull that breakage away from the area so that we create the space to allow that blood and oxygen to move back into the area of need. But if we're dealing with something chronic, like this happened a number of years ago, because of that breathing mechanism, now our entire body becomes patterned into what we're doing. And the feet and the hands are the furthest from the engine. So they become the holding patterns for everything up the chain. So when we're dealing with concussions, most importantly, we really want to get that breath going. The neck, of course, is the rib cage is the foundation for the neck and the head. So we want that open. We want that breath strong, but we also want to be able to look at what's going on in the extremities so that we can bring those back to alignment to support cell alignment up the chain and create that space for flow.
That's awesome. So as you were giving that description, I was thinking about the changes that happen actually when we sleep, because I find you're mentioning about how trauma can basically be trapped if you can't work it out, and that can affect your breathing. And so that's fascinating that even when we're dealing with the brain, that's not, well, I guess the other interesting thing is we think about the brain just being up here in the head, but our nervous system, as you mentioned, is spread throughout, including the hands and feet as kind of anchors. And wow.
Yeah, absolutely. And I mean, for people that have sleep apnea, as an example, that rib cage alignment, which again is driven by our limbs, if we're collapsed and twisted in through here, then we're not getting that, again, proper elimination of the toxins we've absorbed and brought into our system during the day, as well as not getting that proper oxygen to go into those deep, restful sleeps where we actually go into that repair process.
Right, Deanna. And then what I'm finding is that the number one risk factor for developing Alzheimer's turns out to be not getting enough N3 deep sleep. And I can see how if you have some of these blockages, you're not going to get down to the deep sleep, because you're talking about how the diaphragm works, but I can see how it may not work properly if you have some of these fascial or other issues.
Well, and it won't. And that's the thing. So wherever we are in our age, time, health, in this very moment, we all have some degree of compression in through the rib cage area. So even if you start doing breathing exercises from the space that you're in, you will be able to keep strong what you have available to you. But that 2,000 pound per square inch seal even connects the ribs. And so when we're starting, we want to be able to release the rib cage so that we can access more of the diaphragm. So that's the difference between just focusing on proper breathing and understanding fascia decompression in conjunction with correct breathing, so that we can really optimize this beautiful plate of muscle. And the reason it's so important to breathe diaphragmatically, it's at the base of the lungs where the majority of the oxygen receptor sites reside. So if we're breathing stressed, breathing through the muscles of the upper chest, we're maybe only pulling the air in 1/3 halfway down into the lungs, where we want to draw it all the way to the base through that beautiful belly breath. And then we also want to be able to move the toxins and the waste out of the base of the lungs through that really strong exhale. So we always teach people we want to be exhaling for a count of 6, inhale for 4. So whatever that count is for you, we want the exhale to be longer in duration so we can move the past out to create space for the moment to pull that oxygen in. And again, bring it deeply into the lungs through that beautiful belly breath, and then also integrating the ribs, but starting from the diaphragm, because most of us are really caught in the upper chest breathing, which also impacts our brain frequency. I love it was Power of Now, Eckhart Tolle, who mentions in his book that when we're breathing diaphragmatically, we're living in the moment. When we're breathing through the muscles of the upper chest, we're caught in thoughts of future and past, which is where stress lives and which is basically where fear lives. It's not real. So bringing the breath down to the moment really gives us that opportunity to be present, to turn on the parasympathetic nervous system, which of course we know we need for healing, and all of these things. So even just shifting your breathing to focusing on a longer exhale than an inhale and through the nose is a wonderful start to even just start changing that dynamic.
That's beautiful, Deanna, because you mentioned stress. And what I also know, I see that people with Alzheimer's or other brain issues with increased stress, it's a lot more difficult for them to heal. So it's fascinating that these concepts are all related. I've got to ask, how in the world did you get into this field?
Wow. So 25 years ago, I'd been an athletic therapist already for years. I'm in Canada, so that's very similar to a physiotherapist in the US. So,
Sure.
we're trained to work with elite athletes and to deal with the body. And even though I was trained in nutrition and exercise and all of these things, everything that I was doing wasn't working for my body. I was 50 pounds overweight, struggling with anxiety, depression, chronic pain. And I'm working out. I'm doing 400 sit-ups a day. I'm running. I'm at the gym doing weights. And the harder I was working, the more compressed, congested, and toxic I became. And when I was 30 years old, I started the practice of yoga, which was beautiful because I had a great teacher. Every 30, 45 seconds in class, she would remind us to breathe. And I noticed every time she would remind us to breathe, I was holding my breath. So that became a really integral understanding for me with my own body. And then this one evening, I was having some crazy anxiety attacks at the age of 30 when I started making some changes in my life. And this one attack in particular was the seed of everything to come. In the moment, I actually thought I was going to die because I was so locked in my freeze mode, in that fear. I couldn't catch my breath with that panic. So for some reason, I dove my hand into my abdomen, which I never touched because this was where I stored most of my size and I was ashamed and embarrassed of it. So now I'm diving in with my hands, and the first thing I encountered was pain. But the pain brought me out of my crazy thinking, and I was like, okay, I'm alive, I'm breathing, I'm safe. And then I started intuitively moving my fingers through this tissue, and I felt what felt like scar tissue marbled throughout, even though I hadn't had any injury or surgery specific to this area. And suddenly I'm thinking, well, no wonder when I'm working out, dripping wet with sweat, my belly is still feeling cold. There was no energy coming into the space to metabolize. So after 2 nights of doing this, when I stood up, I felt taller, my belly felt flatter, and then this became my nightly routine. And within 2 weeks, my chronic low back pain was going away, my neck pain was improving. All of these things that were these long-standing chronic issues, largely from standing over a massage table and working on clients, they started to dissipate. And then I started working on my clients in a similar way that I was working in my own body, and I was having incredible success. So that was 25 years ago, as the seed of everything to come through this whole process.
Wow. And I see the blocks next to you, and they look wooden. They look hard. I've had massages with bamboo. Is that what this is, or is this a different technique?
We actually used to use bamboo, but now I live in Winnipeg and we use our reclaimed elm trees. So we're not cutting any trees down. But the reason that we use wood is because bone and wood are similar in density. So when we're working through the layers of fascia, it's at the bone that those roots will hold us with that incredible force. So if we want to be able to get to those roots, we need something with a similar density to bone. If you're using a fascia roller or something that's more porous and you're rolling, you're going to be staying more on those surface layers and not getting to the root of the issue. When we're doing our work, we get into position and we're not moving on the surface. We are gliding slowly through those layers of adhesion so that we can get to that root at the bone. And bone and wood love each other. They're very similar and they're like friends. So some people think that, well, I don't want to lie on something hard. It will be too painful. It's actually really quite comforting. And we always teach your breath is your guide. As long as you're breathing in a relaxed way, you are feeding and healing your cells. If anything's causing that breath to be stressed, that's your body saying this is too intense. And then you can do this on a bed. We've got a whole bunch of variations that you can apply to your body to make use of this to get to the issues if that's the case.
Awesome. Can you talk a little bit about the glymphatic, the lymphatic of the brain, the glymphatic system that my understanding is we've only discovered it literally just 10 or 12 years ago?
So the fascia and the lymph system are intimately connected because it's the breath that will drive the movement of all the fluids through the body. So if our breath is compromised and we're breathing up through here, so will our lymphatic system. It will be stagnant, will be sticky. I always say inflammation is the gold. People always talk about inflammation as being the issue. It is when it's stagnant. However, if we have an injury, the body directs blood to an area with all of the healing components necessary to rebuild whatever structures or tissues have been damaged. If we stop that, then we're actually stopping the body's innate healing response. We want to support the inflammation, but it's when we become stagnant and then that inflammation keeps getting backed up, that it becomes problematic because now it becomes acidic and it can damage other things. And that's the challenge, especially if we're in fear mode. Because when we're in a lot of pain and when we're afraid, we stay in that freeze breathing pattern. So then we just keep accumulating more and more stagnancy. So as soon as we start opening up those adhesions, we connect to that breath, we start supporting the lymphatic system so that we can get, again, the drainage of the garbage and the debris from the areas of concern and then create that space so we can get those proper nutrients to actually heal.
That's beautiful. So can you share with us one or more cases of either concussion or dementia or Alzheimer's that, in your professional career? 'Cause it sounds like you've been doing this for a while of what you've seen and what worked and what didn't work. Yeah.
For sure. Well, my very first experience with working with an Alzheimer's client was probably now 20 years ago. And it was a friend of my father's. And so I was pretty new at that time to really uncovering all of this stuff. So I would see him. I saw him for 5 days in a row, 3 hours a day. I was doing a project on him. So he was, I believe, early 70s at the time. And what was really interesting was he would fall asleep in his chair this way. So every day he's sleeping like this. So that was the first thing that his wife would share with me. And I'm like, well, he's strangling his brain. He's not receiving anything because of that. So what was really fascinating was in that 5 days, we made incredible changes. However, he didn't change the habit of this. So it didn't hold because if we keep, putting roadblocks in the way, that becomes the problem. So that was my first experience. So we did get benefit, but then because he wasn't able to do the work, he was pretty far gone when I started with him. That was the follow-up that he continued, and I couldn't just keep continuing working with him. And I also didn't have block therapy at the time as a self-care modality. So it was just me with my hands. So it was about 2 years ago that I took 13 of my community members. I reached out and said, if anybody's having any post-concussion issues, I want to do a little program and see what the results were.
Sure.
And so we took 13 people. We had 13 markers, whether it be brain fog, vision loss, issues sleeping, anxiety, migraines, all of those different markers that we checked. I put them through this 21-day program. And what was fascinating was every single day I had them doing something I hadn't done before with this work, which was decompressing the eyes.
Huh.
And that was incredible. So all 13 people had improvement in all of the markers.
Can
So
you
that
stop for
was
a second? Yeah, that's amazing results. How do you decompress the eyes? I've never heard of that.
and it's really simple. Like all I had people really doing was, make sure you don't have contacts on. And I always recommend people do it at night because you're going to start also pulling toxins out of the eyes. So they might get red and inflamed. So you want to do it not before you have to be on a call on camera or something, but just closing your eyes and just putting some nice gentle pressure with your second and third finger right on the eyelid as you focus on that nice slow exhale through the nose. And you want to hold for up to 3 minutes. And you're just starting with gentle pressure. But then, and what's fascinating too, is when you do this, you start to sense that one eyeball might be a little harder than the other. You start to feel different textures. But we also would teach people to work up and in and around the orbit because the adhesions will lock the eyes. So think of having a crazy hit on your head, like this massive, the eyes get jarred. And then if they're not reset, then now we're seeing the world from that confused lens. And our center of gravity has to shift because if I'm walking around like this all day, instead of having my head properly aligned, then the patterning will have to change so I don't fall over. And now we're seeing the world again with that skewed lens, which also impacts our center of gravity, how we perceive life, our nervous system, all of those things. So resetting the eyes is a beautiful way, and it's really simple to do. Just again, pressure. We do teach in that course to go deeper in through the area, but that's just something anybody can start with. Again, gentle pressure, and then as it starts to feel okay, you might be able to put a little bit more pressure, but your breath is your guide. As soon as your breathing pattern starts to become stressed or chaotic, that's your nervous system saying, I don't like what you're doing, so let's back off. So we really teach people how to respect their limits with this process as well.
Right. And just so I understand, in this program you did, were people decompressing their eyes themselves, or did they have an instructor doing it first? Or
No, this is all self-care. So the
okay,
whole 21 days, it's really full body work with the blocks. And then that was something that I had them all do at night as a test. And what was actually the most fascinating things, because we have lower body programs, upper body programs, I didn't actually ask people to take before and after photos just because I'm thinking, here are the markers that we were testing, but a few of them did. And what was really amazing is in the after photos, they had some of the best changes in their overall alignment, even more so than if we did a 30-day posture reset where we weren't addressing the eyes. So to bring that center of gravity back onto their heels and really open up the chest, it was so beautiful to see.
that is fascinating. Obviously, if you've got eye issues, high pressure in your eyes, don't do this first without seeing your eye doctor.
Well, and the
Yeah,
thing is too, we also, part of the eye pressure is because of the rib cage. So
right.
when we don't have this area open, then we are under pressure through here. So with block therapy, we're doing whole body reset stuff so that we can bring the entire body to a place of calm inside. And that's another thing that we see all the time is people that are just doing block therapy. We've had so many find that they've had a decrease in eye pressure without even doing the eye work.
That's fascinating. But as part of your program, how many times a day do you recommend someone does self-care for relieving their eye pressure?
Well, for the people going through the concussion protocol, I have them doing it once an evening just for 3 minutes. And again, it's just a
Wow.
gentle,
Yeah.
process. And I don't do it every day all the time, but suddenly I'll be like, okay, I've been in front of the computer too long. My eyes are getting a little wonky. I'll go and I'll do that decompression for a few days in a row. So it's one of those really nice self-care things that we can just all do for ourselves that will make a difference. Because even looking at screens, we're pulling in all of this negative stuff, and the world is so toxic that to clean the eyes out like every other part of the body, we kind of want to wring them out a little bit to get rid of the debris that gets trapped between the layers.
Awesome. And I interrupted you. What role do the blocks have as part of this program?
Fully there. I mean, all the things that we do, we use the
Okay.
blocks throughout the entire body, and we always start in the rib cage and the core because most importantly, we want to teach people to breathe. As soon as they start to understand the breathing, then we turn our body on to be efficient healers inside of ourselves. So even if somebody comes to me with a sprained ankle, the first thing I'm going to do is still get them to start breathing because then they're improving their own ability to heal. And then we start working down toward the issue site. And that's the lovely thing about concussions is we don't even have to touch the head for a long time. If people are really afraid and there's so much pressure and pain in through here, we can create so much release in the body of all of that tension and pressure to start creating a change in this area without even touching that. So I love that piece from a safety perspective, especially when you're dealing with some pretty crazy brain injury.
100%. So, one thing that's interesting is clinically spent many years working in emergency rooms and saw trauma to the ribs. Rib trauma could take some of the longest time to heal because you're always breathing, you're always moving your ribs. Just looking at those wooden blocks there, I mean, if you put a hard block on your rib, that's going to be painful. How do you? Again, is this all self-care, or are you or other therapists working, applying it, or fill me in on that?
We do actually have an academy where I have a body worker program and I teach them my work, fluid isometrics. But from this perspective, it's self-care. And we actually have a rib protocol because rib releases are one of the things that can happen with this, where when we compress over time, the ribs will freeze together. And then when we start putting energy in and in tension with the breath, sometimes they can release. And it can feel like a broken rib sometimes because it's the inflammation that moves into this newly created space, which is adding pressure to an already vulnerable area. So we want to support that. But the beautiful thing is pressure over time. The pressure fibers are larger in diameter than the pain fibers. So as an example, if I had broken ribs here, I would just gently start by placing that block on the area. And then again, like I'm feather touching. And then I start connecting with my breath. And then before I know it, I don't feel anything. So then I can start applying a little more pressure. And then I can start applying a little bit of gentle movement. But we have a protocol to assist people wherever that is. And then from there, you go to lying on the block on the bed. And you also, then you can go to the floor. But on top of that, we also look at what's going on in the feet. So for example, if you have an opening here or a rib fracture here, we want to look at the legs and where they are, because if your foot is splaying away, that's going to keep this area open and vulnerable. So one part of the rib release protocol is to really pay attention to what's happening in our foundation and to bring the feet into correct alignment so that we support that proper cell alignment. And then we take people through those step by step.
Awesome. And so how long did it take in this recent program for concussion patients? How long did it take for them to see improvement?
Well, I would meet with them twice a week as we went through those 3 weeks, and many of them started seeing improvement right away. The very first class we have actually is called Addressing the Vagus Nerve. So it's a 60-minute class where we get into the whole rib cage in through the neck to open up the channels and right to the ears. So that class alone is amazing. People start seeing improvement. But it was varied depending on how severe people were coming in, how long standing the issues were. But again, within 3 weeks, all markers had improvement. So that was really a beautiful thing to see.
Awesome. So people might notice improvement after one session, but it sounds like everyone in your group by 3 weeks had dramatic improvement.
Yes. And really what it comes down to is when we turn on that parasympathetic system just through the breathing alone, we start engaging the body in its natural healing space. And then we have so many different ways too of getting rid of all the clogging and stagnancy in this space. If you want, I'm happy to share another exercise people can just do. I am sharing this all over the place right now. I just started
awesome.
it 3 weeks ago. I'm going to look a little funny because I've got to put my hands in my mouth. So I'm just going to explain it first. So imagine if you've been, again, traumatized and you're like in this forward position. The jaw, this whole area gets really thick, really dense, and we clench a ton. The tongue ends up being really impactful in the clogging of the lymph, as well as improving that blood flow. So what I do is I take my third and fourth finger. Now I'm going to be having both hands in at once, but I'll just explain. We want to put the fingers on the inside of the teeth and down so that we're actually touching the gum and then getting to the soft part of the tongue. So I put both of my fingers in. And then once they're in there, I draw my hands away and then I gently push my fingers down into that soft part. And then we want to focus on the full exhale, breathing through the nose. And while I'm there, I'll just be gently moving my tongue toward the roof of my mouth to start to engage these adhesions that are really deep and locking me in this negative alignment to release. And after 3 minutes, it is fascinating how much improvement there is. So I started doing this on myself only 3 weeks ago with this. I've been doing this, but adding that different piece in. And two weeks ago, I was in Prince George. I'm working with a 23-year-old now who at the age of 21 had a stage 3 axonal brain injury. And one of the issues he had was huge issues with speaking. And and he also had fractured his right clavicle. So that whole arm is very internally rotated, and the tongue and all of that is really challenged in this area. So I had him do this every morning for 3 minutes with me. In fact, we did it twice a day. I also did work on his throat. We're just literally launching our blog, but the difference in how he could speak, also the shape of his head, was fascinating. So if people have tongue ties or issues with their thyroid or any issues with congestion, just doing that every day, it's now my morning routine. I am not only loving how I feel, like it helps clear that brain fog from when you're sleeping if you have that, but also just it really cleans up the jaw. It supports the teeth and the gums. It's amazing, and it's free. Just try it and see what happens.
Wow. And just to be clear, are you putting both hands in at the same time?
Uh-huh.
Like that. Okay.
So I'm drawing my hands away, pushing down. And then as I continue to do it, I'm creating more and more space. So like this morning, as an example, I was able to bring my fingers further back, and I could feel those deeper areas in my throat starting to really let go. So I'm loving this.
That's great. And it looks like you're going straight down. You're not going back. So you're not normally causing a gag reflex.
No, not at all. Not at all.
And when I saw you do it, it looks like you moved your head back. Is it okay to move your head back when you do that?
Yeah, okay. Absolutely. Just like that.
Cool. And it looks like your tongue position when you did that, I think initially I saw it go back, and then where's your tongue does it matter where your tongue is while you're doing that? No, it
doesn't matter, but it's really nice if you can move the tongue while your hands are there. Again, if you start to lift it up, then you're helping support the adhesion melting, the decompression in this space. And ultimately, like when you start doing it, you're going to probably feel that one side is thicker and more painful than the other because we're not symmetrical. So the goal is to bring balance and symmetry into the jaw so the tongue is positioned properly. We've got proper drainage, proper flow, all of those things. And again, when we've had trauma where we've been really tied like this whole area gets so thick and bound. And this is just a beautiful, simple release that's really profound and effective very quickly.
That's great. And you said that often people have noticed an asymmetry. One side might be worse. That just means you need to do more work on the side that's worse, right?
It's just really more of an awareness. And as you continue to do the work, you'll start to feel that balance coming into both sides.
And while you're doing that, are you breathing through your nose, or how are you? Okay.
Yeah, I really promote, I love James Nestor's breath book, where he supports everything we talk about in that nose breathing. I know there's lots of really wonderful meditations and exercises where you can breathe out through your mouth, but from the resting perspective and from the healing perspective, the nose breath is really where it's at.
Beautiful. And did you come up with this exercise, or did you learn it from someone? You did?
No, I came up with it. And the reason I started doing it was because I have 2 molars that have been removed. And over time, if I don't stay on top of things, then everything starts to migrate. And that's where we start to see age. So I'm 55 and I'm very aware of, we're all aging. So I started just doing the pulling apart a long time ago just to support the breadth of the jaw. And then it was just, again, 3 weeks ago, I started moving my fingers more deeply, and I'm like, oh my gosh, this feels incredible. And then I could feel after the first time how much cleaner my jawbone felt. So then it just became this fun little thing. And then when I shared it with Daniel and I started to see the changes in how he was communicating, now I'm just sharing it with everybody because it's just so amazing.
I love it. And do you have a name? Is this like the Deanna mandible manipulation, or do you have a name for it yet?
Tongue decompression right now.
I love it. But it sounds like you're not actually even touching your tongue during this.
No.
Okay.
No.
Sweet. Well, that's so cool. I have if you're okay, I've got a list of quick questions for you
Sure.
related to this.
Yeah.
Let me just pull it up. Can you give me one word to describe what fascia feels like when it's healthy?
Water.
Awesome. And what's the most neglected area of the body for brain health?
Between the toes.
Oh, wow. And can fascia work help with brain fog, yes or no?
Absolutely.
And what's the first sign someone's fascia is under chronic stress?
The first sign. For me, personally, it would be seeing their alignment. As soon as I see somebody out of alignment, their fascia is under stress. And that's every single one of us. None of us are in perfection.
Makes sense. Neck tension and memory problems, are they connected?
Yes. Neck tension, though, is really coming again from the collapsing of the rib cage into the core. So there's a whole bunch of cause sites to look for that. Yeah.
Cool. And how long, you have the blocks, or how long typically will someone use the blocks in one of their therapies?
So most of our programs, we share a 30-minute class. And people, once they start this is a lifestyle. So people become very engaged because it's simple to do. It's a therapy, exercise, and meditation all built into one thing. So a 30-minute class, and then becoming aware of alignment. We typically have maybe 5-minute classes to really teach postural alignment that can go with those in our programs.
Awesome. And what's your favorite tool besides the block?
My favorite tool besides the block. I love those vibration machines. I stand on mine not every day, but probably 5 days a week.
Awesome. And what's one daily practice you will never skip?
Smiling at everyone I see.
Aw. And what part of your own fascia gives you the most trouble?
My left hip. I've had a lot of past injury, so it's one of those things that I had a very bad injury when I was 7 as well as when I was 3. So when we grow with injury, it's a little deeper and innocuous. So to find all those threads can be a little challenging. So that's my issue.
And what would you say to skeptics in 10 seconds?
You have nothing to lose. Learn how to use your body as the way God intended, and the benefits will teach you how to thrive instead of simply survive.
And what's next in fascia science that we're not ready for?
Well, we have a new tool that we've just launched, our face paddle, and I love this. And for concussions and head stuff, it's beautiful. I don't actually, Kenny, would you go grab from my purse one or one over there? It's one over there. Yeah, I've got my tech guy here with me, Kenny. So the face paddle is incredible because of the landscape, and thank you, the landscape and architecture of the face being so different than the rest of the body. To get into the intricate spaces in through here, through the orbit. This is beautiful. It acts more like my hands. And block therapy is the self-care version of fluid isometrics, which I started as the hand that I work on and teach to other practitioners. But this is a beautiful way to get into the deeper areas of the body that are hard to reach. So we have our facelifter program that we call it, that's 9 classes starting from here up. It's beautiful at opening up this whole area to really promote that release and that flow. And then we're going to start adding other classes for the entire body with that tool.
Beautiful. Next question, going back to the Deanna tongue release you described, would it also be helpful to use one hand in the mouth and one hand outside, pushing against each other? Would that?
Yeah. Yeah,
Okay.
absolutely. The more we can get to those deeper areas, and the feet are one of those things. Like, this is just reminding me of a new class I just created for the feet, because again, we've got 26 bones in the feet constantly being affected by every step we take. And we want to get to the deepest adhesions in the feet. So I've got a whole bunch of classes where we're standing on the blocks, using them in different ways. But then I did one where I was seated, and then I was using my other foot to really crush the foot so we could hold and get to those deepest adhesions. So that's the thing. Like, we want to try to get to every part of the body. So being creative is awesome like that. I love it.
Beautiful. Is there any question I should have asked but didn't ask you?
Oh, I know. A really great hand release, because of course, when we're dealing with anything through here, I always say that the limbs are the puppet masters of the core, and the hands, when in anatomical position, our hands are forward. Yet if you look at pretty much anybody, their palms are pointing behind them, and that
Can you,
creates that.
yeah,
Sorry?
can you show us again? You see your hands are forward being.
Yeah, so anatomical position is palms forward, but most people are walking around like this. So the act of simply standing or walking with your palms forward, that in itself lifts the rib cage, and people will feel a difference in how they can breathe. But I want to show a really quick hand release technique to also, just like between the toes, we also want to release the webbing between the fingers, because they will hold us. If we have a Dupuytren's or a carpal tunnel or arthritis, those hands are very strongly keeping everything up through here locked. So simply placing between the thumb and index finger, and do this more at belly button height so you're not really stressed. I'm just trying to show you. We want to spread the fingers and push, and we want to feel it. Hold for 3 minutes as you exhale through the nose, longer than you inhale. Then go between the second and third fingers and spread the fingers and push and feel. Then between the third and the fourth, this one hurts me the most. And then between the fourth and the fifth. So I could be doing this right now and you wouldn't even know. So that's what I love about some of these things. We can do them when we're doing other things. But when you release the fingers and then you bring those palms forward, the lift and the relaxation that happens through this whole area is absolutely beautiful. And just on that note, the toes truly are the most important, because this is the furthest area from the engine. So this is where we are most strongly held. So if I do all this work up here, but now I start walking and I get pulled back into the pattern of my feet, a lot of that work we're doing won't hold. So releasing between the toes, you can take a finger, a pencil, and you want to push again, just like the fingers. You want to feel that pain between each toe, holding for 3 minutes. For people that struggle to reach, you can take a cord. I mean, we've got cords throughout the house, and wrap it around the toe. And then you can just sit back and you can pull on the cord to get that decompression between the toes. That is a beautiful thing. They've actually connected longevity and toe strength. So when we can get those toes from being how they've been patterned and twisted and free them up so they can become part of the equation for balance and for walking, it also helps us bring our center of gravity onto our heels. Simple, easy to do, again, free for anybody. So the 3 most important things for concussion would be release the toes, release the fingers, and focus on your proper breath.
Wow, amazing tips. I think you may have mentioned very briefly vibration plates. Are those safe for someone with concussion or dementia or?
I love them because it really gets that lymphatic stagnation moving.
Makes
And
sense.
I always say to people, it's how you feel. So I know, like with my vibration plate, you can go from a very slow to like 99, which is the highest and is vibrating fast. So I would play with it and I would get on there, but I would go at the limit. If you have a concussion or dementia or Alzheimer's, in and of itself, when you combine it with this work, then you're releasing the adhesions to support the movement of that stagnancy. So that's all I would just want to say about that.
Beautiful. So Deanna, you've got me really excited, and I'm sure much of the audience too. How, if someone wants to find you, where and how, and because I know you're up in Canada and I've got some viewers up there, but yeah, go ahead.
So my website is blocktherapy.com. We also have a YouTube channel with tons and tons of free videos. My most favorite place to send people is if you're on Facebook. We have a private Facebook community group called Block Therapy Community. There's over 18,000 members there. And the reason I love it there so much, I have 2 moderators manning it, but we have a beautiful community of people. So people that have had concussions, people that have Parkinson's, MS, fibro, like all of the stuff. And if you ask a question, you're going to get people responding from their experience, which is really where the depth and wisdom comes in with this practice. But also we have a free gift for everybody. It's a 9-part series teaching you how to do this work using a rolled up towel. And a rolled up towel is pretty dense and it gives you the sensation and the understanding. So as a trial, Anybody can have that right away and start immediately to really understand how to open up the breath and the full body. And that's a great place to start.
Cool. And we'll have that available in the notes for this. Tell me more about if they want to talk to you or reach out to you personally. I understand you're really busy, but are you personally on social media, and can people reach out to you personally?
We have tons of social media on all of our different channels. People reach out, and then what I will do is I'll get on once a month and I will answer questions that come to me personally through here. I have a amazing customer support at blocktherapy.com, and if people want to find me, they can share and get directed to me. Also, once a month, I go on a community call for anybody and everybody where they can come out and speak to me personally. So again, if you want to find out more about that, support at blocktherapy.com would be a great place to go.
Wow, Deanna, thank you so much for sharing your expertise with us, and also working in this field for so many decades. It's exciting to meet an expert like yourself who has some real world solutions for people with Alzheimer's and concussions and other common aches and pains. I love your focus on self-care. It's so nice. Thank you so much.
Thank you so much, Dr. Josh. It's been an absolute pleasure.
Awesome. Thank you. Peace and plants.